Okay, so for a postpartum assessment, you're going to come in and introduce yourself, perform hand hygiene, and provide privacy. You're going to ask them how they're feeling and how they slept, and then start with PQRST. So ask them if they're feeling any pain. If anything makes the pain, if they're feeling pain, ask them if there's anything that makes the pain better or worse. And then the quality of the pain, if it's dull or sharp, and region where it hurts, if it radiates, severity on a scale of 1 to 10, 10 being the highest, when did the pain start, and how the pain is affecting them. So we're going to start by listening to heart sounds. You're going to listen to the aortic, pulmonic, Erb's point, tricuspid, and mitral valve, and note any abnormal sounds. And then you're going to listen to lung sounds as well. And it should be clear. There should be no crackles or wheezes. And then you're going to do the breast exam. You ask the patient if they're breastfeeding. If they are, they should be wearing a tight-fitted wireless bra. Even if whether they are breastfeeding or not, they should be tender. Ask the patient if they feel if their breasts are heavy. And then you're going to palpate the breasts. You're going to palpate the breasts, and they should feel soft. Nipples should be clean and intact bilaterally. There should be no cracks, and no ask them if they've seen any yellow discharge coming from their nipples. And then they're going to do their upper extremities, like their arms, and feel their radial pulse. If it's strong or weak, and check the capillary refill. Should be less than 3 seconds. They should have an IV, so you're gonna check the IV, check the side of the IV, make sure it's clean, no signs of infection, which would be redness and swelling. And then move to the lower extremities. You're gonna check for edema, check the dorsal pedis pulses. It's normal to see edema, like +1 edema, but you kind of want 0. But in postpartum, 1 is normal. Then the Homan sign. So you want to check for the Homan sign. A positive Homan sign, what you'll do is lay the legs straight, flat down, and you're gonna flex their foot and feel the back of their calf. And if the patient feels pain, then there's a positive Homan sign. If there's no pain, there's no Homan sign. And then move to the GI tract. You're gonna listen to bowel. Ask them when their last bowel movement was. It's normal for them to not have bowel movements for a couple days after delivery, but if it's excessive, like several days, then that should be looked into. And you're gonna listen to the bowel sounds. So you're gonna listen to the right lower, lower, the right upper, the left upper, and the left lower. And then palpate the same. Right lower, right upper, left upper, left lower. And you're gonna feel for the liver as well. Well, not necessarily, but if you feel the liver, that's a sign of preeclampsia. And then you also want to check the abdomen while you're here. Like if there's a C-section, you want to check the C-section insertion for any redness, bruising, edema, or drainage. And you want the sutures to be well approximated. The urinary tract, you're going to ask the patient if they have any trouble urinating, and when was their last, and are they urinating frequently? They should be urinating 3,000 units a day. And then you're going to check the catheter if they have one. Check the catheter, the color, the amount, the smell. Smell might indicate infection. And then check the insertion site of the catheter for any possible infections. And then also ask when's the last time they changed their pad. They should be changing it every time they go to the bathroom. If they're not, we just tell them, advise them to. And then note the amount of lochia on the pad. Clots are normal as long as they are smaller than a golf ball. And you would note the color of the lochia and the amount. And then you want to palpate the fundus. So you're gonna put your palm here, one hand here, and then kind of palpate with your fingers for the top of the fundus. And you want the fundus to be should be midline with the umbilical and underneath the umbilical. Well, not underneath, but below. And then the last thing you're gonna do is assess the episiotomy and laceration sites, and like any epidural sites or anything. You would check for hemorrhoids, check for the epidural site, and the laceration sites for any redness, edema, drainage, or anything like that. Any bruising, or any skin breakdown. And then if everything is normal, you would change the patient's pad, cover them back up, perform hand hygiene, and document all your findings. And that is the end of a postpartum assessment.